And still on the way this morning.
It's normal for a new mom to be a little emotional, but when is it postpartum depression? A local doctor weighs in. All right, thanks, Rich. You know, having a baby is supposed to be one of the happiest times of a woman's life, but it doesn't feel that way if you have postpartum depression. Well, the good news is there are ways to treat it and sometimes even to prevent it. First News contributor Dr. Michael Sevilla joins us now with more. Thanks for being here this morning.
Good morning.
Do a lot of women suffer from postpartum? You hear about it a lot, but numbers-wise, is there a percentage of women that really go through this?
Numbers-wise, not really sure, but we do know people talk about baby blues and what that's all about, and we do know that about half of women have that baby blues, which is starts right after delivery, can go even up to 2 weeks following that. But if people start to have symptoms of depression or just not feeling good after that, that's when we start worried about postpartum depression.
How often does the postpartum depression go hand in hand with actually physically not feeling so well? Some women have a tougher time with delivery, labor and delivery, than others. Some take longer to start feeling better. Does some of that equate with the depression?
Well, we do know that some of the risk factors for this are if you have depression before you get pregnant, or if you have other psychiatric problems like bipolar disorder. We also know that if you have a tough social situation or not very good support at home, we do know that it's also tough, but also other things too, like maybe a tough labor, a tough delivery, or even what they call the fussy baby, colicky baby.
Right, so there are many reasons that might help add to the problem.
Yes.
Okay, now, what are ways then that you can help yourself, or your spouse can interfere there and get into it so that he can find ways to help you?
Well, the first thing is just to kind of recognize if you think there's going to be a problem, or if your spouse thinks there's going to be a problem, if you've been kind of feeling down, or if you've been even treated for bipolar or depression before pregnancy. You just have to kind of recognize that may be a problem even after pregnancy. Some people are on medication for depression beforehand. You may want to talk to your doctor to see if it's a good idea to continue with that. And also for moms, you know, just to kind of ask for help, you know, and just so they get enough rest, so they eat healthy, so they exercise, so they get to feel a little bit normal again after pregnancy.
So it's okay to bring grandma in, or an aunt or somebody special maybe to help out, because if you don't get your sleep and you're not doing the things you need to keep yourself healthy and feeling better, that's going to probably compound the problem.
Sure, sure. And if, you know, if mom's not feeling good, or if she gets sick, you know, that's going to affect the baby as well.
And is it okay to take some of these antidepressants when you're breastfeeding? And because we've talked about that this week, is that okay, or is that, I mean, there are probably some that are okay.
Yeah, some of them are okay. Definitely consult with your doctor about you know, what specific ones are best for you.
Okay. Thanks so much for being here this morning.
Great.
We want to keep the time happy for everyone.
Absolutely.
It's nice to know what to look for.